Hi everybody, it's your mama. Hello. Check me out. Y'all going to the doctor with mama today. So I got my luxurious fur on. Let's see if I can give you a better shot of it. I'm waiting on my Uber, y'all. Y'all see, they know your mama. They got an Uber coming that's a Benz. Okay. This is what 53B breast cancer survivor look like, honey. Looking good, okay? You see? We looking good. So, we're gonna be going in the Uber. I'm probably not gonna be able to take you inside of the cancer center with me, but I'll take you as far as I can, probably up to the door. But I can't show any of the people because, you know, that's patient confidentiality. But y'all get to see your mama. We're going to go to my doctor's appointment today. Hopefully I'll be getting this off, you guys. Here, let me see if I can get you a better view of this thing that's been making all this noise for y'all. Here it is. This is the wound vac thing that's been gurgling in all those videos. Yes. Just so you know, that's what your mama got to deal with. So we're going to head out to the Uber, in the Uber in a minute and get to the doctor. But I'm excited to take you guys with me on my journey. Like I said, I wish I had started doing this earlier, vlogging when I was going through my treatments and things. But hey, never too late for whatever. So make sure you get those breast cancer exams, ladies. Get your breast screenings ASAP. If you're over 40, you need to be having them as soon as possible. Especially since when I found my lump, like I said, I was supposed to go and get a mammogram, and I kept putting it off because I had a jerk boss that wouldn't let me take any time off of work. Just do it, ladies. Do whatever you got to do because that lump comes fast. My lump came and it was about the size of this. And it was in my right breast, which is why we have that wound vac on that side. Yes, child, I got the Vogue on today. Yes, honey, yes. So y'all will be going with me, like I said, and I'll keep you updated. Hopefully I'll be getting it off soon, but I don't think he's taking it off today because I'm in a little bit of a pain. And I've got a little soreness there and some more drainage still, so we'll see. All right, y'all. So I'll be right back. Your mama's serving up fashion today, y'all. Yes, honey. With these glasses and everything. I'm standing here looking in my mirror, y'all, so in case y'all wondering, ignore that old ignorant doorbell back there. I gotta get my doorbell done. But anyway, you know, it's fine. I have a doorbell. It just, that thing was there when I moved in like that. And I wound up getting one of those rings. And it works better than a regular doorbell. So anyway, yes, child, serving up fashion today. So we'll be going to the cancer center. Like I said, I just scheduled the doctor. And we're going to be doing some unboxings later on. I just got like 3 packages in from Amazon. So I will be showing y'all that. Yes, justice for Brianna. And it's another girl that passed away to injustice done by the police in Harper Woods, Michigan. And I don't want to mispronounce her name, so I will look her name up. But we are trying to get justice for her family as well. So, these police need to stop killing us, y'all. I'm just saying. So, we'll be going. My little dog is outside using the bathroom, y'all. So, I'll be right back when we in the Uber. Okay, so the Uber's pulling up, you guys. I'm just getting ready to head on out. And I'll see you guys when I get inside the Uber, okay? Bye-bye. Hi.
Hello.
Oh, you want to do it on my forehead?
Nope, on your wrist is good.
Okay, good.
Go ahead and register. Go ahead and sanitize.
Thank
Do you know what you're here for?
I'm here to see Dr. Chaudhry.
Okay. And we'll have you. You can be in the second circle. They'll have to get you registered. Yes, ma'am. Okay. She's all blinged out.
Yes, I am. I blinged out today. I'm serving y'all a little bit of fashion today.
We're going to do it every day.
Girl, I do. Even when I'm asleep, you know. I try. You have to do it to try to make yourself after this stuff. We're just waiting, you guys. Hi, you guys. We're in the doctor's office, as you can see. I'm not at home. I'm gonna get ready to put my little gown on, and I will let you guys know. Just a disclaimer, I'm gonna cut out my Uber trip over because I don't have a disclosure from her. She was sharing some of her personal information, so I'm not going to have that scene on there. But just so you guys know, my Uber driver's real good people. So, and she's also, you know, sister in this cancer journey. So, hey, you're not alone, honey. We with you. So, I will be back when I'm done with my examination. And I'm on my way out the door, y'all. Okay? All right. Hi, guys. Okay, so we're waiting on the doctor to come back in. He finished his exam and everything and beat me up, but I'm gonna still have the wound vac on. Right now it's off because he changed the dressing, so I have to have it reapplied by my nurses. Here it is, this little loud gurgling thing. But he's good, you guys, because he keeps me together. So but I will be on him a little longer, and so anyway, we'll be dealing with that. You know, like I said, we'll still have to take the medicines and do what we gotta do while he's on. But we're not going to stop and get discouraged, because I do have, and I'm on a mission to be back to work in January. So we're going to pray that that's going to happen, you guys. Yeah, my doctor beat me up so bad he done messed my bling up, y'all. See? Oh my goodness. But anyway. I'm glad I got to bring you guys on my journey today. You got to see what your mama looked like, because you never seen what she looked like. So, you know, this is me. Usually on my normal visits to the doctor. So, I'm here at the doctor now. And for those of you who might have just joined or whatever, you know, trying to get checked up. He just cleaned me up a little. And, you know, typical things you have to go through when you're a survivor and you're in remission. They've already taken everything out, and like I said, I'm still healing from the surgery. My wound vac is not on right now, so that's what I need to go film when the wound vac ain't on. But anyway, so that's it, y'all. You know, when the nurse comes back in, gives me a lot of stuff, I'm about to head on out. Alright, you guys, so be right back. Hey guys, we're on our way down on the elevator now.
Bye, girl.
Bye.
See you.
Happy holidays.
Same to you. Thank
So we'll be dealing with him for a little bit longer, but it's okay, you know. God has got us. God has got us. So I really intend on being back to work in January. If I had this wound back still, you know, it is what it is. So whatever. Whatever wound back. Anyway, y'all, thanks for taking my journey with me. I'm gonna get in my Uber and I'm gonna go home, and I'll be back with you guys later because I got some unboxings to do. Yay! Peace out.